Well, if coronavirus crisis wasn't enough, now black fungus is also wreaking havoc in the country. Delhi Health Minister Satyendra Jain confirmed that approximately 200 cases of black fungus have been reported in Delhi. The High Court has also asked the centre to import the medicine here. This is an antifungal drug called Amphotericin B, and it's used to treat black fungus. According to the central government's data, there were a total of 7,251 cases of this infection as on the 19th of May. With the deadly infection spreading fast, the Health Ministry has written to states asking them to declare black fungus an epidemic, essentially notify the disease. Rajasthan, Karnataka, Tamil Nadu, Telangana and Punjab have already done so, while the situation in other states is also worsening. In Maharashtra, 90 people have already succumbed to complications due to black fungus. In UP, more than 100 cases and 9 deaths have been reported because of this infection. Meanwhile, Jammu and Kashmir reported its first case of black fungus, while Goa reported its first death due to the fungal infection.
साथियों, हमारी इस लड़ाई में अभी इन दिनों ब्लैक फंगस की एक और नई चुनौती भी सामने आई है। इससे निपटने के लिए जरूरी सावधानी और व्यवस्था पर ध्यान देना जरूरी है।
परसों तक 197 केसेस दिल्ली में एडमिटेड थे, सभी अस्पतालों में मिलाकर। और 197 में दिल्ली के पेशेंट भी थे और दिल्ली से बाहर के पेशेंट भी थे। इसकी जो दवाई है, उस दवाई के लिए केंद्र सरकार ने उसको कंट्रोल किया है। केंद्र सरकार सबको कोटे के हिसाब से दे रही है। दिल्ली को अभी उन्होंने 2000 के लिए कहा है देने के लिए। जैसी चीज मिलेगी हम अस्पतालों को दे रहे हैं, हॉस्पिटल्स को दे रहे हैं। ये प्राइवेट में घरों में इसका इलाज नहीं हो सकता है, तो एडमिटेड पेशेंट का ये इलाज होगा, उनको हम दे रहे हैं।
There are concerns about the shortage of the drug as well, and also that often cases of black fungus are going undetected because the symptoms in fact creep up slowly rather. Doctors have been saying that those who are diabetic must monitor their health condition and that they are most prone to black fungus given the fact that wrong usage of steroids seem to be triggering black fungus. Anisha Mathur is in Delhi giving us more details on that story. Delhi too is seeing more than 200 cases, Anisha. What else is the government now planning to do?
Well, Sneha, just yesterday we saw the announcement being made by the Delhi government that 3 hospitals will be turned into treatment centers, that they will be trying to source more medication, because remember the biggest problem that Delhi and indeed the rest of the country is facing is the lack of the medication Amphotericin B that is required to treat black fungus. Just yesterday, this Delhi High Court was also informed by the centre that there are a total of 7,251 cases of black fungus so far across the country. The centre has also written to various state governments asking them to declare this as an epidemic and take action accordingly. The Delhi government, of course, has said that they're trying to source the medication. Rajiv Gandhi Hospital, GTB and LNJP will be created as treatment centres for this disease. An expert committee has been set up under the guidance of senior ENT doctors to look into distribution of the medication, because at the moment the biggest problem is that because there has been a sudden rise in this particular disease, because this infection was termed as a rare infection. There were very, very few cases normally, but with the more and more steroids being given to patients for combating COVID, diabetics and people with cancer are increasingly becoming vulnerable to black fungus. So now the government is more medication.
All right. Thanks for the moment, Anisha Mathur, with that report from Delhi.